Hi, Dr. Dan here from Resolve Physical Therapy. Just want to give you a brief overview of the anatomy and mechanics of the knee joint and how the femur and the foot can influence our knee. The knee is a hinge joint made up of the femur, our thigh bone, and our shin bone, which is the tibia. When we bend our knee, the tibia is going to rotate inwards. When we straighten our knee, the tibia is going to rotate outwards. Oftentimes, when we experience knee pain, we lose the ability to do this motion. Okay. Now, also to consider is when we bend our knee and my tibia rotates inward, the femur, our thigh bone, is going to rotate outwards relative to the tibia. When I straighten my knee and my tibia rotates outwards, my thigh bone, my femur, is going to rotate inwards. Okay, they do the opposite. When that motion is lost, that's typically when we experience knee pain or put ourselves at risk for an injury. Now, let's say my tibia has good motion, but as I bend my knee and my femur is not rotating out, that is an issue going on in the hip joint itself. Okay, so people with knee pain typically look like this. Their shin bone, their tibia, is rotated outwards. Okay, so when they go to bend their knee, they're not getting that external rotation at the femur. They're just getting all of the external rotation at the tibia. The tibia is not rolling in as it should. Okay, so if the hip joint can't move into external rotation as we bend our knee, my tibia can't move into internal rotation like it should, leading to knee pain. Now, the foot is the same thing. When I bend my knee and go into internal rotation, my foot should go into dorsiflexion and pronation, meaning that arch should flatten out. And the opposite is true when I straighten my knee. My foot goes into plantar flexion and supination and creates a rigid arch. So if you're experiencing knee pain and you're not addressing the pelvis and the hip joint and the foot joint, you're missing out on a huge opportunity to resolve yourself of that pain. I hope this video helps.